Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Here's your host, Cyrus Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again, both for our radio audience here in Mississippi at WYAD 94.1 FM and WYADonline.com. We're glad you all could be with us. Also, just tuning in to our friends at iHeartRadio and Amazon Music Podcast. We're glad you all could be with us as well. We're following this under part of your News You Can Use segment. As you guys know, every month there are different causes that are being brought attention to. In November, one of the causes that is being recognized is National Diabetes Month. It's one of those things that really does impact us all. In fact, over 1 in 10 Americans, that's 34.5 million of us, are suffering from diabetes, according to the CDC, and that doesn't even take into account the over 88 million adults who have prediabetes, an astounding 34% of the U.S. population. But there are things that we can be able to do and to know, and that's going to help us all in our health journey. Here to talk to us more about it, we're excited to welcome Whitney Morgan to our program. Whitney's someone who's able to reverse her type 2 diabetes diagnosis. We also have Dr. Jeff Stanley joining us today to talk to us more about some of the treatment options as well. Thanks to the two of you for the time. Really appreciate it.
Good morning. Thank you.
Yeah, thank you.
Glad to have you both. Dr. Stanley, I want to start with you. I mean, what are some of the common symptoms of type 2 diabetes?
Yes, some of the most common symptoms that people tend to have with type 2 diabetes are things like fatigue, frequent urination, or blurred vision.
And Whitney, as I mentioned, you were able to reverse your type 2 diabetes diagnosis. When were you first diagnosed with type 2 diabetes?
Just a little over 5 years ago, and it was not a total shock because I had gestational diabetes with my second pregnancy 19 years ago.
And how were you able to manage it?
Well, it wasn't fun. In fact, it was quite a struggle. I had to see multiple doctors who put me on so many different medications. My system is very hypersensitive to side effects of medications, and nothing seemed to be working until the last year or so. And then more recently, with Virta Health, it really made a major change for me.
Dr. Stanley, diabetes is one of the things that has been considered a chronic progressive disease that requires medication, but is there another way that it can be treated?
Yeah, absolutely. Again, as you mentioned, for folks who have been diagnosed with diabetes in the past, generally they're told this is going to be a chronic and progressive disease. They're going to need to be put on more medications over time. And what we've found is that, in fact, diabetes can be reversible with the correct treatment. And so our team, we utilize a combination of physician supervision, health coaching to really help patients make lifestyle and dietary changes so that they can bring their blood glucose to a normal level and then no longer need the medications to help control the diabetes. And we found it something that's just really empowering for people to be able to help take back some of that control over their health.
And that leads me back to you then, Whitney, because you took part in a program, the Virta Health program. How did it help you in reversing your diabetes?
Well, I have to share that a couple of years ago, I had one doctor who kept switching medications on me, and he actually had the gall to say, I don't know what else to do with it. We're running out of options, which felt like a death sentence. And when Virta was offered to me just back in December, I didn't know that this was going to be so life-changing. And what it has done for me has reversed my diagnosis. I'm off of my medications. I've lost 39 pounds in the last 6 months, and I feel healthier than I've ever felt. It's empowered me to learn that I can actually take care of my body and to keep myself healthy by food, by nutrition, and by guidance, than continuing to take medications for the rest of my life.
Oh, that's incredible. Whitney, Dr. Stanley, I mean, when we hear accounts like what Whitney was able to share, it really is encouraging. But how long does it typically take to reverse diabetes and get a patient off of medication?
Yeah, the amazing thing is that it can happen really quickly. So, I will see in my patients that in some cases, even in the course of weeks, people can bring their blood glucose from very high down to a normal range and reduce their need for medications. So this is something that can happen in weeks to months, even though the diabetes may have taken years or even decades to develop. And I always, tell folks that I really feel like I have the best job in the world, in that my patients are getting healthier and they're, becoming self-sufficient and learning how to make these changes over time, so that, again, they're not reliant on the medications and that they don't feel like diabetes is this slow death sentence.
Yeah. Dr. Stanley, who is a good candidate for Virta treatment these days?
Yeah, so I would say it would be anybody with type 2 diabetes who feels ready to make a change. And again, this may be that they're sick and tired of feeling sick and tired, that they feel like their doctors told them that where their blood glucose is now is going to need insulin to treat. Again, or people that may have had diabetes for decades. I mean, the thing that's been really great to see is that even in my patients who've had diabetes for 20 years and are on medications like insulin, we're still able to see diabetes reversal and these quick improvements in blood sugar and health.
Whitney, I want to ask you, what advice do you have for people, considering what you've been able to benefit from? What advice do you have for them who have been recently diagnosed with diabetes?
Well, it's kind of funny. My husband and my mom both said I could become the poster child for Virta because I share my story everywhere. Even people who don't have diabetes but have issues with their weight and, their knees and that kind of thing and inflammation, educate yourself. Go to VirtaHealth.com and click on the link that says Get Started. Find out if you're eligible and get into the program. But you have to be committed to what changes you're making, because that's the only way that you can actually get yourself into a healthy lifestyle. It's completely sustainable. It's been so life-changing for me, and it's been life-changing for my family. They enjoy the foods that I cook, and we're not sacrificing anything, I promise.
Wow. I'm so glad that you're sharing your story, Whitney. I'm so glad that we have Dr. Stanley with us. Again, that website is VirtaHealth.com. We're going to link that up for our radio audience on our Facebook page, and for those joining us on iHeartRadio and Amazon Music, we'll make sure that we link that for you guys. Again, everyone, Whitney Morgan and Dr. Jeff Stanley have been our guests, talking with us about a treatment option for those who have type 2 diabetes, just in time, of course, as we're recognizing November as National Diabetes Month. Thank you to the two of you for the time. I really appreciate this information for our audience, and looking forward to having the two of you back on the program again.
Thank you for having us.
Yeah, thank you so much. Take care.
You as well. And we thank you all for tuning in to another great segment of Conversations Live, part of our News You Can Use segment. Until next time, I'm your host, Cyrus Webb, saying as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Now let's go make today amazing. Take care.